The Chinese describe, in the 17th century, they described 4 stages of infectious and feverish diseases. This 17th century, this was described, and the use of jade screen was not included in any of these stages. The jade screen comes before any of this. It's to prevent yourself from even getting into the ballpark of having to deal with it. But once you're in this cycle, the herbal formula, because there are actually many that you could use, but the one that's most commonly available, and it consists of 9 herbs, is called yin chow, and it's commonly prescribed for colds and flus, and it has these 2 herbs that I mentioned previously, the Lonicera or honeysuckle and forsythia, as 2 of the major herbs in it, along with 6 other herbs that have antiviral and antibacterial properties. Very seldom have I found yin chow to actually cure the flu, and that gets back to my very first mention, which is if you can treat yourself with yin chow during the first 2 days and really dose heavily. By heavily dosing, I mean really load early on, because these are just herbs. They're like food-like things, special foods. So you take like a couple of tablets or doses of this every hour, every 2 hours during the early stages. I have seen it repeatedly. If you can catch it at that point, knock it out. But once the die is cast, once the pins begin to fall down and the bowling ball has hit, then the flu has to run its course, and colds have to run their course. And then you're taking these herbs basically to lessen the severity and lessen the duration. And it's very important, because they do that, but you don't want it to get to the last 2 stages of feverish disease. The last 2 stages are when you're involved with organ damage, like pneumonia damaging the lungs, or the result of organ damage, which is bleeding from various internal organs. So the first 2 stages, yin chow is used, or herbs similar to that. Now, other things can be used instead of yin chow, but that's the simplest in terms of the message here that is readily available in stores throughout the country. This is the formula of yin chow, and it's not specific for the flu, because in fact no herb is specific for any disease. Herb treats the condition in which diseases arise. And so yin chow treats the common cold, it treats flu, it treats high fever, treats chills, headache. Sore throat is one of the underlying symptoms that is a good indication for the use of yin chow. Cough and conditions that are known today as pneumonia, acute respiratory infection, tonsillitis, epidemic encephalitis B. Now I would tell you that if you know anybody that's got meningitis or encephalitis, I would rush them to a medical care as soon as possible, and not mess around with trying to treat it yourself with some herbs that you're buying at the local health food store. That's ridiculous and stupid. A qualified health professional. Even I avail myself of the luxury of having medical doctors who I think are better equipped to deal with serious life-threatening diseases than I am, even with all my herbs and knowledge. Here we have Lonicera and Forsythia buds. You've all heard of the product called Airborne. Airborne is basically a product that was created for flight attendants on the airplanes to not catch the various bugs that would fly around in such an enclosed space, and also for school teachers. And it was quite a successful, and it still is quite a successful formula for that. It's based on yin chow. The only thing I have to say about it is that the dose of yin chow that's in Airborne is very, very small, and I would favor buying the yin chow formula itself and taking higher doses of it than using the commercial product Airborne. But whoever put that together knew that yin chow was good for colds and flus, and they use it both preventively as well as for treatment. Finding the right herb for the right person and right condition is one thing, and taking sufficient dosage is the next thing. Most people hardly take enough herbs when they actually get onto it. What we're allowed to say as being the dosage on any product is usually at least a third to half of what actually a person should take to get a full therapeutic dosage. There are a lot of reasons for that, and basically, and I don't want to get into them, but basically, it is a good idea to start out modestly with an herbal prescription, but as soon as you feel like your body is tolerating all right, immediately start increasing to full therapeutic dosage. Now, I studied American Indian herbology. I studied a little bit with the Karok Indians, and I studied with other Indians in British Vancouver. I learned about a few herbs that they still could remember in those areas, but the one thing I learned more than anything else, I learned about dose. There was a woman named Grandma Bessie Tripp who lived on at the forks of Salmon and Klamath River, and Bessie Tripp used to ask me to go up and pick Princess Pine, Pipsissewa, for her to manage her congestive heart condition. And I bring back a big bushel full of plastic bags full of Princess Pine from the forest, which I give her. And she would readily take the entire thing and throw it into a pot on her stove and boil all of it all at once, can a bunch of it, and she'd drink a quart, 2 quarts, 3 quarts a day until she felt better, until the fluid around her lungs was relieved, and she lived to 103 years old and managed her condition beautifully by taking herbs that way. I also saw other Indian people in British Columbia using red oak bark for arthritis and rheumatism. And I remember her having similarly 4 pots of brewing on the stove with red oak bark all over the place, red alder bark, I'm sorry, all over the place, boiling the living daylights out of this, and drinking quarts of it until the arthritic pain was relieved, usually within 2 or 3 days at that kind of dosage level. And she'd usually make enough that anybody else in the nearby who had problems with that would come over with their cups and say, "Give me some." And so she'd be the connection for red alder bark tea for everybody with arthritis in her area. And I remember studying with Dr. Raymond Christopher when somebody asked him the question, "How much herbs should you take?" And he basically said, you tilt your head to one side, and when you have a steady stream of herbs coming out one ear, you probably realize that you've taken enough herbs. And finally, a very good friend of mine and a colleague named Subhuti Dharmananda, who's a first-rate scientist and an exponent of Chinese herbal medicine, respected throughout the world and in China as a source for the esoteric knowledge about Chinese herbs, would also talk about the fact that one should take enough herbs until you feel yourself just getting a little bit sick to your stomach and then back down. So I'm not saying that maybe that's what you should all do when you're taking herbs and you're sick, but you should get close to the idea of saturating, because herbs basically come to our body, and I'm talking about herbs that are, of course, not toxic, and such as the ones I'm mentioning in this webinar. They come to us, and they're used by the body as special foods. So in order to get a full therapeutic benefit from them, we need to take them in sufficient dosage to notice that. But always err on the side of caution. Start out with a low dose and gradually increase and see how you're feeling with it.